What is knowledge management? According to the World Health Organization, knowledge management is the use of technology to enable people to create, capture, store, retrieve, use, and share knowledge. Knowledge management is an intentional process that includes identifying the knowledge needs of a particular audience and then generating, curating, and sharing relevant knowledge to help deliver effective programs. Knowledge management for health provides a systematic approach to ensure that professionals have access to the latest research and that they apply that research to inform programs and practices at all levels of the health system, from the global, regional, and national levels down to the front lines.
Of all the adjectives that I could use to describe twinning, the one that comes first to my mind is the word innovative. Currently, in 10 African countries as well as the Caribbean region, twinning builds the HIV/AIDS workforce by developing unique cadres of healthcare and social service workers tailored to the needs and situations in each of these respective areas. For all of the many twinning-related activities, the transfer of knowledge is essential, especially for considering the relevant research related to these activities, which is always evolving. That is why the Learning Resource Center Conference is extremely important. Through twinning learning resource centers, healthcare professionals have access to the latest research to inform programs and practices at all levels of health systems, from the global, regional, and national levels down to the front lines.
As Dr. Morales has mentioned, it is very clear that twinning innovatively fills so many important gaps related to the provision of HIV/AIDS services in Africa. I understand that one of your main objectives during this conference is to share your experiences and ideas for best practices related to LRCs. I'm sure that this will be an especially exciting exchange, and I look forward to learning more about it.
The HIV/AIDS Twinning Center of the American International Health Alliance has been involved in health systems strengthening through volunteer-driven twinning partnerships and initiatives across Africa. So the concept of the Learning Resource Center, when it started, actually, it was about providing access to medical information resources to support medical education, to support clinical practice at the different institutions, hospitals, clinics, medical universities, and health ministries. At that time, access to internet was a problem. In most institutions at that time, it may be one desktop computer. So we had to set up a kind of an ICT hub, and that hub would provide access to some online databases, to some offline databases, providing training to healthcare professionals on how they can formulate such strategies, on how they can retrieve information resources that they need for their practice and for implementation of different programs. We do have some sites that are specifically optimized for mobile access, like on the go. But if you're accessing that information on a mobile device, it's specifically optimized, to improve user experience and also faster download speed. So when you're using a mobile device, there are more opportunities to integrate that with offline media. You have some offline resources on your mobile phone that are regularly updated.
E-learning represents one effective method AIHA has adopted for transferring knowledge to our twinning partners. According to the World Health Organization, e-learning can transform learners from passive recipients of information to active participants in knowledge acquisition. E-learning offers effective learning and instruction at the learner's own pace, and, depending on the technology used, can also provide hands-on experience with automated feedback, giving the learner immediate correction of errors.
Whatever the students enter onto their tablets is sent to a server that is on a cloud server, and then it's accessible to us on our side on our computers. The advantage of this is that even if students do not have an internet access, they can log this information and it will save it, and as soon as they are within range of internet access or a Wi-Fi connection, it'll upload to our server. From what we're running out a pilot right now, and feedback from the students have been that it's a much easier system having to swipe through than flipping through 10,000 pages in the logbook to find the procedures, as well as having to run to the supervisor to initial every procedure. Whereas on this logbook system, the supervisors receive a summary version of what the students have done, and they sign off with a password system.
The aim of the pilot e-learning course was to give access to e-learning material to those people in resource poor areas in Africa as well as South Africa. The material can be accessed by the students at their own time and at their own pace, which is important because all learners learn at different paces. So one of the learning management systems that Stellenbosch University uses is Moodle. It's a software application for e-learning education courses and for training. It provides the instructor with a way to create and deliver content, monitor student participation, and also monitor the students' grades and their level of understanding. The theme coming across here is active learning of the students rather than passive learning.
A key focus of the Knowledge Management Program Strategy meeting was providing partners with an overview of various evidence-based repositories of information that can help them improve the quality, efficacy, and cost-effectiveness of the treatment, care, and support services they provide. Technical experts from AIHA and other organizations showcased successful projects and strategies that could be adapted to the needs of partner institutions throughout Africa.
The Cochrane 2020 vision is, our vision is a world of improved health, where decisions about health and healthcare are informed by high quality, relevant, and up-to-date synthesized research evidence. So you can see that this links very well with the work that's happening within AIHA and the general vision of informing all aspects of practice and healthcare and decision-making on best evidence. So the idea is that we should increase regional and international partnerships for sharing skills and resources. Within AIHA and the Cochrane Center, there's certainly opportunities for that. We need to balance support for actually doing reviews and actually be pushing more people's use of reviews to realize this Cochrane vision of better healthcare for everyone. And then developing relationships with decision makers, whether those decision makers are at a policy level or they're the patients themselves who have to make a decision for themselves, to enhance them demanding evidence from us and not just taking what we say on face value.
So about point of care tools, what are they? They synthesize current evidence for diagnostic tests and intervention procedures. They are designed for rapid consultation at the point of care. And healthcare practitioners who use them actually say that they use it as a second opinion. They are always evidence-based and frequently updated. Another wonderful tool are alert services. So actually, this is how to keep updated with evidence-based information in your specialty. You can go to this online service, which is for free, and choose which is your topic of interest or topics of interest and subscribe to it. Then once a month you will see what other specialists in your medical specialty considered most important, which were clicked on, like the main 10 or 20 articles that were read by specialists. And also that could be done as a service of your Learning Resource Center.
We developed an electronic resource for social work, education, and practice. So So this what this website does is it facilitates access to updated information and learning resources on social work and practice. So basically there is like two sides of it. On one side, it's like this virtual community of practice for social work educators like faculty across social work schools in Tanzania. But also on the other side, it's just this central location of electronic resources and evidence-based practice materials.
What is our MEPI, Stellenbosch University Rural Medical Education Partnership vision? What we want to do is to develop, implement, and evaluate innovative, workable, and effective medical education models. People have said, and which is true, is that we in the Western Cape are privileged. If you compare us with some of the schools that you come from, we are indeed privileged. So why are we getting funding? And we feel that the contribution that we can make is to try out some of these things, see if it's working, and then assist other people from other countries to implement it as well. And our second aim is to strengthen health systems within rural and resource-constrained environments. So the three aims, and this links with the MEPI overall aims, is to improve quality of medical education, to influence retention, and to strengthen locally driven research in Africa. So those are the three main overarching aims of MEPI.
You see that Stellenbosch University Medical School has quite a few projects with rural learning, but that's the group of students which is important for us. That's students, medical students who spend their final year of training at rural, that's an elective, and they spend that at rural sites. In the end of all that, they all get assessed the same way. So the immediate concern became, we don't want to put those rural students at a disadvantage. We need to make some of the tutorials, some of the stuff that goes on in the faculty available to them as well. And so the idea was to make virtual classrooms, VCs, available in those subject areas, which then translates in having to build a number of virtual classrooms in the clinic, which then can be viewed at those rural sites.
At the Knowledge Management Program Strategy meeting, AIHA also engaged presenters who showcased cutting-edge technologies and new opportunities that partners might want to pursue in the future as a way to strengthen evidence-based clinical practices and improve productivity and patient outcomes at their own institutions.
And after all our discussions, the solution that was sort of pushed was the tablet on wheels solution. Basically what we will do is, it's a tablet on wheels, it's got the software on it. The screen would be locked down so that one can't access any of the other features of the tablet. We are working on language translation to be able to have the software actually prompt, in Xhosa. There would be a little leash attached from the tablet to the wall, which is a charging leash as well as a security leash. So the solution becomes mobile. The triage application is pretty much a decision support system where one navigates really piecemeal through an algorithm. But for example, a solution for doctors, emergency medicine practitioners, requiring quite a lot of information in a very quick period of time. These are the emergency medicine guidance protocols produced by the University of Cape Town and Stellenbosch, which TOMSA has undertaken to digitize as a mobile application.
But with the use of the digital pen, you can fill out the form in the field, right? And within a couple of seconds, it transfers that information back to a server. So you could be in Timbuktu and filling out a form, and you can see it anywhere in the world once it is sent. There's a camera inside here, right? It doesn't take pictures of you, it only takes pictures of your pen strokes that you're writing on the form. All right, now you see all the forms that have come through onto the system after refreshing, right? So let's look at Anne's form. Okay. Okay, Exactly as you've written. So imagine from Kenya or Uganda or wherever, all they're doing is using the pen, filling out that information, and ticking on send, and that information goes via the cell phone back to the server in France. But the paper is sitting there in Uganda or Kenya or whatever.
So one of the ideas we have through Taryn Young and the Center for Evidence-Based Healthcare, we're working in collaboration, is policy buddies, building demand for evidence in decision-making through interaction and enhancing skills. And this has started with a situational analysis looking at what's happening in the provinces in terms of policy making, finding out who the policy makers are and what are their policies that they're working on. And now linked with that is going to be capacity development on, for example, the 4-day primer on how to conduct how to read a systematic review. And then a buddying system of a researcher and a policymaker to make sure that you can go in partnership to make sure that the best evidence is integrated into policy making.
What is evidence-based medicine? Evidence-based medicine is the conscientious, explicit, and judicious use of the current best evidence in making decisions about the care of individual patients. The practice of evidence-based medicine means integrating individual clinical expertise with the best available external clinical evidence from systematic research. Participants at AIHA's Knowledge Management Program Strategy meeting worked closely with experts in evidence-based medicine, strengthening their knowledge on a wide range of related topics, as well as their capacity to train others at their institutions.
Overall, these are the trainings that we have done since April 2012 in collaboration with the South African Cochrane Center, led by Dr. Taryn Young. Only 6% out of 35 knew that the South African Cochrane Center is the reference center for their country. And only 8.3% of them have attended EBM course, and none from Namibia actually had any exposure to formal training in EBM. So overall, I think knowledge about EBM is very low, and we need to have a rigorous campaign, and that campaign has to be decided with the relevant country offices.
For us to promote evidence-based, people need to be trained and know the use of EBP. So target the clinical staff and also the students, it being the university teaching hospital, so we have access to those students. Then also, of course, we don't want them to miss out on the Learning Resource Center and how it actually promotes the evidence-based as a resource. So looking at on the deliverables 2 and 3, we thought we should train Learning Resource Center users and also the new staff.
So you can say the Learning Resource Center coordinator in collaboration with the nearby whatever stakeholders or strategic partners, okay, instead of saying committee, blah, 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 strategic partners will be conducting the relevant training, okay, to targeted individuals.
So in terms of expanding our learning resources program, we want to expand it so that it can better meet the needs, the information and communication needs of our twinning partners in the region. So under this comprehensive program, the first objective is actually, we want to make sure that within our institutions, we have mechanisms, we have platforms in place to ensure access and utilization of knowledge resources.
So when we see those wonderful work plans soon, that's not the end either. Reach out to each other, talk to each other if you have ideas. Some people from social work, know others now who are working in social work. You have your media counterparts, you have a defense force, you have pharmacy, etc. So this is a real opportunity to continue that collaboration so that you can build knowledge management activities within your institutions and ultimately improve the lives of those in your country and around the world.
I want to say to all of you never to underestimate what you might be able to do with the technology and the methods and the tools that we're talking about now. Does everybody here know who Bill Gates is?
Yep.
Okay, 50 years ago, who knew Bill Gates? No one. How many people here know who Mark Zuckerberg is? Created Facebook? 10 years ago, who knew who Mark Zuckerberg was? He wasn't. So the things that we're doing now, it's impossible for us to know how far they might go. Don't doubt the potential.